Hi, this is Dr. Bird again. Today I would like to discuss what's going to happen, what can possibly happen, and what kind of symptoms a person can experience with the loss of cervical lordosis. What it means is that the nature, angle, or the curvature of the cervical spine or the neck would be in this C-shaped form. But many people who have jobs that require prolonged sittings, 8 to 12 hours a day, and sitting in front of the computers over the longer period of times, they would start their posture musculature would start weaken, and they would start leaning forward. As a result, they would start losing this cervical lordosis. And over the course of maybe 5, 10, 15, 20 years, depending how bad the job is, this cervical lordosis turns into like a spine like this. So you'll see somebody going sideways and their neck is like going forward. So what's ended up happening, first of all, in this particular structure, what's happening, you're putting a lot of pressure on these, you see these things between the spine. These are called intervertebral discs. You put a lot of pressure on these intervertebral discs. And in a longer period of time, these, the edges of the vertebra is going to create osteoarthritis. So it's going to be like a spur. I showed you in one of the other videos. This would be the end result. This is what it's going to look like versus normal one like this. And you don't want that to happen. So the symptoms that can be associated with this kind of problem could be like obviously neck pain, severe neck pain, headaches, all these nerves that travel from the spine, they innervate vital organs, and they also supply the innervation, the motor innervation to your upper extremities. And as a result, you can start feeling the weakness in your upper extremities. You can also create these symptoms called carpal tunnel syndrome, which is I call a carpal flat syndrome, because tunnel is actually good for you. And these impinged nerves can create, like I said already, can create a lot of pain. And a lot of people just take pain medications, which in the long run just destroy liver and kidney. So what we can do, this is kind of like a preventative video, so you don't get to the point where your spine is like this and your bones deteriorate to this level. This video is about to educate many people who have prolonged sitting job positions, so they can avoid these problems in the future, because they think, oh, I'm going to be done. And by the time they finish doing this 20-30 years, the spine is completely deteriorated and cannot be restored. So what you don't want to do is basically get to this point where it's straight with the preventative chiropractic care and some exercises which we can recommend. Keep the spine like this. Keep your spine like this, your discs like this, and avoid any pains. The moment you start having pain and pain in your spine, in your neck, in your upper shoulders, you start having headaches, you feel fatigue, and you still feeling paresthesia in your upper extremities, don't wait. It's not gonna get better. It's just gonna get worse. And when it gets worse, it takes longer, it costs more, and the recovery rate is a lot slower. So hopefully this video was helpful. I'll come out with more updates as time goes on. I will provide more information also about the next video blog post will be about the loss of lumbar lordosis. And what also is going to come up is the one of the cases where a patient came in this female patient thought she had a heart attack, but what was ended up happening, she spent like thousands of dollars at the emergency room. What ended up happening, she had intercostal nerve was impinged by the misaligned rib, and which can mimic the heart attack because it goes along the left side. If it happens on the left side, it goes along the left side of the rib. Anyway, have a good weekend. It's Friday now during this recording, and I'll talk to you later.